met you at the Dresden tonight. I just called to say that I had a great time, and you should call me tomorrow. Hi, Nikki, this is Mike again. I just called because it sounded like your machine might have cut me off. Get out of a 6-year relationship, okay? That should help explain why I'm acting so weird.
Mike?
Nikki, great. Did you just walk in, or were you listening all along?
Don't ever call me again.
Wow. I guess you're home.
Well, that is perhaps the most painful voicemail scene in film history from the movie Swingers, showing a dumped lover's desperate attempt to get back in the saddle again. Whether you are lucky in love or not, the chances are you have had your heart broken at least once. I can vouch for both people on this set. It has happened to us. But is heartbreak an actual medical condition? Something that can be treated, perhaps with a prescription? Some doctors say yes, and they just held a heartbreak clinic in Amsterdam to actually study and discuss the condition. Dr. Philip Muskin is a professor of clinical psychiatry at Columbia University Medical Center. He's my guest now. Hi, Doc.
Hi, how are you?
I'm fine, thanks. You know, who can't relate to the feeling of being dumped and that hideous pain and nausea and how it can completely disrupt your life? But now they're holding this heartbreak clinic that suggests this could actually be a medical condition and not just the normal woe is me couple of day thing we go through when we get the heave-ho.
Well, heartbreak, as you said, is a normal, sad occurrence in life. Very few people have had a relationship that didn't end in heartbreak, and maybe it's part of how we grow up. But for some people, heartbreak may be more than the normal course of events in life and may lead to consequences. Though I think you put it correctly, it is a normal part of life for the vast majority of the human race.
How do you know if your heartbreak is serious enough that it actually now requires medical attention?
Well, let's look at it this way. We're wired to have relationships with other people. And so that engages our brain and parts of our brain that are very important in terms of the reward system of the brain. And for some people, that reward system doesn't turn off easily, and the heartbreak doesn't go away in a few weeks, or for some of us, a few months. It's all day, every day, rather than you think of the person a little bit every day, or you're not all that productive at school or work. So if that heartbreak goes on for a very long period of time, or if you really become despondent, or certainly if you think, I can't go on this way in any real way, that would suggest it's more than heartbreak and might have moved on to a clinical depression.
And you say that according to this clinic, this study, they found that heartbreak, or that being in love and that feeling it gives you, can actually be as addictive as heroin, or alcohol, or some of these other things that people get addicted to. Now, the problem is, if you experience heartbreak, it affects, according to these doctors, many parts of your body: brain, digestive tract, heart, blood vessels, kidneys, and so on and so forth. So while you're sitting there feeling blue, lots of your internal organs could be taking a beating?
Well, our brain controls our entire body, and our mind is somewhere inside of our brain. So that heartbreak you feel, you really don't feel in your heart, do you? You feel it in your mind. And your mind is now controlling your heart and your intestines and the rest of your body. And we know that there's a very strong linkage between what goes on in the brain and what goes on in the body. People who are depressed, for instance, have a much greater chance of having heart disease, and people who have heart disease and are depressed, no one's happy with heart disease, of course, but those people who are actually depressed have a much more higher chance of having a heart attack, and people who have heart attacks and are depressed are probably 3 to 4 times more likely to die than people who've had heart attacks and aren't depressed.
So now the question becomes, all right, you're sitting there with a broken heart. You can't help it. If somebody's going to dump you, they're going to dump you, right? Or maybe you're the dumper and you're heartbroken because you had to do it. Either way, the question is, how do you get out of this heartbreak as quickly as possible and with the least amount of damage to your internal organs? Now, this clinic out in Amsterdam was offering its patients chocolate, which doesn't seem like enough. Then they recommended, you tell me, this is what I see in one of the articles, that at least one of the doctors is suggesting one of the cures for lovesickness is a little action. Is that true?
Chocolate's fun, and chocolate's good, and in moderation, chocolate's terrific. Exercise is very good. Exercise is a powerful anti-anxiety and antidepressant. taking care of yourself.
I'm not talking about exercise, Dr. Muskin. They're saying get a little action in between the sheets
Well, I'm
with
talking
anyone
about
other
all
than your
kinds of
ex. Is that
exercise,
true or
sure.
not?
Yeah, having a new relationship. I'm not talking about casual and meaningless sex, but having a new relationship, renewing old relationships, going back to your friends. You know, when we're in love, we sometimes don't pay any attention to our friends for a while. That's part of it. I think that meaningless sex is meaningless sex and probably should be avoided by most of us.
Wait, because Dr.
Re-engaging.
Liesl Dawson of the University of Bristol says that when you have sex, you release hormones like oxytocin and vasopressin, and that they may neutralize the effect of lovesickness. Confirm or deny?
I would have to deny that. Yes, he's right about the hormones, but he's wrong about the consequences of just having sex to have sex.
Yeah, and I'll tell you what, one thing these researchers agreed on is that if you continue to see your ex, the one you're trying to get over, it will increase the difficulty for you, and that it will endure the possibility of continued reactivation of the love hormone. So stay away from your ex, and according to Dr. Muskin, stay away from sex unless it's meaningful. Doctor, thank you so much for being here.
Thank you.
He was an excellent guest, wasn't he?
He was.
Took it very seriously. We were joking and kind of snickering during all the movie clips.
Well, listen, Dr. Bristol.
And we could go on and on and on about the movie clips.
Dr. Bristol says they have a little action.
Yeah.